5 on your health tonight. More Americans may be struggling with mental health problems, but a new national report says Massachusetts is handling the challenges better than any other state. In fact, every New England state except Rhode Island ranked in the top 10 overall for mental health care and access. Here to explain is Dr. Scott Hadland, Chief of Adolescent and Young Adult Medicine at Mass General for Children. Good to see you, Doctor.
Good to see you too.
Well, that map paints a pretty clear picture, Dr. Hadland. It's pretty much the entire Northeast from Pennsylvania north to Maine. You've reviewed this report from the nonprofit Mental Health America. Why is our state and our region doing so well?
Well, first of all, just to kind of put things in context, we still have a massive mental health crisis going on across the country. One data point that the report raised is that of all children and teenagers across the country who need help for a mental health problem, only about half of them actually receive any help. And so that amounts to about 3 million kids and teens not getting the help that they need. Here in Massachusetts, as you mentioned, we actually ranked first in the country on a lot of measures. In fact, we ranked first overall. And the main reasons are that we have better access to mental health treatment in the state, we have better insurance coverage, and then we also have lower prevalence of some of these mental health conditions, probably because we do a better job of preventing and treating these conditions. And so our prevalence, or the percentage of young people and adults who are struggling, is actually lower than other states in the country.
Okay. As you know, Dr. Hadland, there's a strong link between mental health and substance use disorders. That's one of your specialties. So in your opinion, what can Massachusetts do better?
Well, we have a lot of work to do when it comes to both mental health and substance use. And in fact, if you talk to any teenager, any family, or any clinician who's navigated an emergency situation, they will tell you, good as we may be in Massachusetts, we still have a lot of work to do. I think the bar has been set so low across this country that it doesn't take much to rise to the top. And Massachusetts is doing well, but we have a lot to do. Families will tell me that they're encountering, whether it's for mental health treatment or addiction treatment, which is especially difficult to find, long wait lists, poor insurance coverage at times, high out-of-pocket costs. And then even when you do find care, it's often very fragmented, meaning that, you get your medical care in one clinic or one hospital, but the place where you get your mental health or addiction treatment is often miles away in a totally separate facility. And that's really difficult for families and for patients to navigate. So we're working really hard in primary care, including in our clinic where we treat teenagers and young adults at Mass General, to try to bring that mental health and addiction treatment right into primary care so that you're getting that treatment right alongside your other medical conditions in a trusted place from a trusted clinician.
So what do you tell your patients about how to find a therapist should they need one?
Boy, it's really tough. I would start with your doctor. We pediatricians, especially when it comes to kids, are here to help. And I view it as part of my job to help families navigate our really complicated mental health system. One thing that comes up all the time is that it's difficult to find a match between a therapist and your insurance. And so, on the screen right now, you see a website that's really helpful for many families who are navigating this. It's masshelpline.com. This is the Massachusetts Behavioral Health Helpline. And there's a phone number here that you can see. This is a helpline that's available 24 hours a day, 7 days a week that you can call, text, or chat. And this is equipped with behavioral health specialists who can help families navigate to locate a therapist who can help make sure that their insurance will match and will be accepted by that therapist, and sort of, hold families' hands through this journey. And again, we doctors and pediatricians are there to help as well.
That's great information out there, especially right now. We need that information out there. So Dr. Hadland, we always appreciate you being here and giving us your insight. Thank you so much.
Thank you.
We missed the mustache, though, Dr. Hadland. If you missed him on Friday, he had a pretty serious one going.
Oh.
Yes. All right, Dr. Hadland, good to see you. Thanks so much.